case of post-stroke leg stiffness and rehabilitation. So, Kevin, okay, Kevin, we can start. You didn't open the mic.
Hello, good afternoon. Can you hear me?
Hello.
Okay, good afternoon, everyone. Good afternoon to all the doctors, Dr. Lee, and all the other doctors from Tsuchi. And thank you for once again for this opportunity for us to present this case. Okay, so today I'll discuss this case on titled Unlocking Mobility, a case of post-stroke. Sorry, second. Sorry about that. Hello. Okay, so once again, a case of post-stroke leg stiffness and rehabilitation. Okay, so we have a patient, SS, 59-year-old female, a business owner with a chief complaint of left leg stiffness and pain. Her visual appearance upon consultation was uneasiness due to the pain that she was in. So for the history of present illness, 6 years prior to consult, patient experienced mild stroke with no residual deficits, and then experienced 2 additional mild strokes 1 year and again 6 months thereafter, respectively, with some notable stiffness and numbness in her hands. And then 2 weeks prior to consult, patient was walking long distance at a farm in high heels. The next day, she noted stiffness in her left leg, causing pain, graded 9 out of 10. The patient took pain relievers and warm compress on the affected leg, which afforded some relief. Continuation of the symptoms prompted consult. So for the traditional questions, the patient was in pain, graded 9 out of 10. The temperature, she sweats easily, and both legs and feet were slightly cool to the touch. For her sleep, it was affected due to the pain and stiffness of her leg. And her diet, she is fond of buffet and only rice meals, but on average, she tries to have a combination of fish, meat, and vegetables. For her lifestyle, it's quite stagnant. There's no active exercise aside from occasional walking. Bowel and bladder were normal bowel movements daily. For her medications, she takes multivitamin, telmisartan amlodipine for her hypertension, and linagliptin for her type 2 diabetes. For her mind and spirit, it is stable and she is feeling hopeful. For her past medical history, she has hypertension, hyperlipidemia, and diabetes. No food or drug allergy, no asthma, and occasional headache. For the family history, no stroke, and there is history of cardiovascular disease on the maternal side. Okay, here we see the tongue and pulse assessment for the patient. Quite obvious, you can already see the tongue appearance. So for the color, it's purplish, has a red to purplish tint, which would signify some blood stasis. The coating, you can see the thick coating there, more of a thick white coating, pointing to dampness. The shape is swollen and there is moist for the tongue. On the pulse, it was felt to be slippery, which also would signify the dampness and phlegm. For her muscle testing, all are normal except on the lower left leg, 4 out of 5, and sensory was all normal. Okay, moving on to the TCM diagnosis. For the 8 patterns diagnosis, it's internal heat, and the Zhangfu diagnosis is spleen sheet deficiency with damp heat. So for the treatment principles, we want to nourish yin, tonify the spleen qi, expel the dampness, and invigorate the blood. So for the Western diagnosis, this can be more of a post-stroke spasticity that we're looking at. So it's a common condition in stroke survivors associated with pain and joint contracture. So a lot of times these post-stroke patients, you would notice the affected side. There would be some joint contracture where they can't fully extend their joints. And spasticity would be due to muscle contracture. So there's somewhat of a miscommunication from the brain to the nerves and the muscles. And studies show that 72%, so a majority of these type of patients with spasticity do experience pain. So here are the treatment points that I use. So some common points: liver 3, liver 8, stomach 32, Susan Lee, and some along the spleen channel. And then to also bring some calmness to her anxiety, we use Neguan, Shenmen, along with um, uh, Do 20 as well. And then Higu and Yintang and Shishen Kong. And along with these,
Unlock your phone. If you update your
sorry. And along with these points, we also applied heat therapy along the left leg and also her lumbar area. Since the pain was in her left leg, very stiff, she was compensating in her stance and as well as her gait. So she started to feel some pain in her lumbar area as well. And I also did ventosa of the back and some Tuina massage also to help promote blood circulation, qi circulation, and relieve the muscles. So some key points that were used are, of course, Zusen Li to tonify the spleen qi, strengthen her digestion, improve circulation. San Yin Jiao to strengthen the spleen. We want to transform dampness, as I mentioned, nourish the blood. Since a lot of times in stroke patients too, the blood circulation is restricted. So especially in the affected sides, we would notice that the skin would be cool to touch since there's poor blood and qi circulation. And then Yan Ling Quan for also to help drain the dampness, clear spleen, stomach stagnation. Tai Chong to move the liver qi, improve the circulation, resolve the stagnation. Bai Hui to lift the qi, clear the brain fog, and Naiguan to harmonize digestion and calm the mind. So for the treatment results, after the session, the patient was able to walk without assistance and noted that the pain has decreased to 3 out of 10 and felt very relaxed with the leg stiffness resolved. So I just want to point out too that when the patient consulted, when she arrived at the clinic, uh, reminding that her pain scale was 9 out of 10, and she actually needed assistance to walk from her car into the clinic. So you can imagine how much pain she was in. And since the leg was so stiff, that's why she needed assistance as well. So after the session, she was actually able to walk without assistance, and you can see that there was significant pain reduction. The patient was also advised lifestyle modification, the usual to avoid fried fast food, canned processed foods, control her diet since she's fond of buffets and unli rice, and some other foods that are shouldn't be eaten on a regular basis. Also to increase her fruit and vegetable intake, and I emphasize that she should start doing some light exercise as well, like swimming. Since the patient is overweight, this will only increase the burden on her joints. And also, since she's predisposed with hypertension and diabetes, this is also why I strongly emphasize her for lifestyle modification. And upon follow-up, 1 week later, the patient's symptoms improved even more, only with some slight pain noted on the sides of her left knee. So in conclusion, we can say that acupuncture is safe and effective therapeutic modality to help control and relieve pain associated with post-stroke spasticity and weakness. Other factors may be improved with acupuncture, such as psycho-emotional stress and anxiety reduction. A lot of times in these patients, if they experience pain, like in this patient, it also affected her blood pressure. So she had a spike in her blood pressure as well due to this pain and stiffness in her leg. So the acupuncture also helped relieve her stress, anxiety, calm her shen, and she was able to get better sleep as well. It also is for, of course, to improve the qi and blood flow, very important for post-stroke patients. Okay, so after that, I received consent from her, of course, for the treatment and also for a short testimonial that she wanted to give for her before and after. So it is in, mostly she's speaking in Tagalog, but I think I can translate it to Chinese. So I hope that you can understand, okay, for the most part. Okay, let's try it out. Let me just turn on the caption. Okay.
Mm.
Yung naninigas siya.
So she's telling
Sobrang in pain
how
talaga
stiff it
ako kasi
was, how much pain
ano
she was
to,
in.
yung antigas na mga muscle.
It was very
Hindi
stiff,
ko siya
her
ma-straight,
muscle.
hindi ko siya ano ba yun, parang natiklop, ma-fold yung paa ko. Ano ba right term doon? Oo. Then, then, hindi ko rin siya, then super hirap igalawin.
Very difficult
Lalo
for her
na
to
pag
move.
yung tatayo ka.
Even standing up was very difficult.
Kaya pumunta kay Doc, magpa-acupuncture.
Sige po.
Magpa-schedule dapat ng Monday, pero talagang mabuti hindi available si Doc kasi hindi ko rin kayang igalaw yung paa ko.
She couldn't even move
sobrang
her
sakit na
feet.
talaga.
It was very painful.
Yung Tuesday, na-rest ko lang the whole pinilit ko nang galawin kahit sobrang sakit. To the extent na hindi ako makastep doon pagdating sa clinic. Di ba? Hindi tayo ako makastep doon.
So she's telling how it was so painful that when she got to the clinic, she was not even able to walk. That's why she needed assistance.
Kaya makapasok. Yung mali, ano lang naman ang doon, steps, di ba? Then after, yun na. After nung
So,
after
Tuesday
nung, after ang acupuncture, yun. Nakababa ako maayos sa bed. Then, yun, nakalabas ako na maayos na nawala yung pain. Yeah.
Hindi nyo na kailangan assistance, tita, or?
Hindi na. Hindi na.
Paano nyo po matidescribe yung before and after na improvement?
Ay, sobrang alwang kasi kaya ko na igalaw yung paa ko. Nakakalakad na akong mag-isa na. Hindi na matigas ang mga muscle ko. Ayan.
Okay, so there you have it. So she described how you can see how coming to the clinic, it was so painful, so stiff to the point where she couldn't walk without some assistance. And then after the session, as she said, she was able to easily get off the bed. She can walk, was able to move her feet, and no more pain. So that is from the patient
I'm
herself.
Salis.
Okay, so thank you for your time. If you have any questions or comments.
Since Dr. Kevin, this case very good, and we can see acupuncture can help people, especially stroke people. We can recover his mobility. So now, does anyone have question? 戴老师，
Hello, Dr. Kevin. I have
Hello, good afternoon.
suggestion. I have a suggestion is about maybe you may use the 八段锦, maybe another safe and effective therapeutic models to help control and release the pain associated with the post-stroke and spasticity and the weakness, because the 八段锦 is another exercise and qigong can facilitate to treatments and facilitate the acupunctures. Above is my suggestions.
Okay, thank you very much.
All right, thank you, Dr. Lai. And in my clinic, I have some suggestion to Dr. Kevin, and people have some stiffness. I often use the manipulation to improve his ability. Maybe can add the manipulation on 竹山里 or 丰隆 to improve his ability. And in other way, or I also use scalpel acupuncture, maybe in the motor region or sensory region, also can improve his function. So this is my suggestion. Thank you. Okay.
Thank you.
Does anyone have question? Okay, I think this is very good case, and we have learned a lot this case. So now we can close this session. Thank you. Bye bye.
Thank you.
Thank you very much. Thank you everyone for attending.
Professor Lai. Thank you. Bye bye.
Bye bye.
Thank you, Dr. Lai.